and why the standard treatment of 99% of doctors in the emerging world are helping, but not enough. So the standard treatment of Lyme disease, which is a bacteria, but it is not one thing. You look at me, I have one head. You look at Lyme, it has 4 different forms. So the most common drugs that are used are doxycycline, we'll call that doxy, which I think is a little funny. And in our cartoon, I think it's very funny. And the other one is amoxicillin, which we'll call amoxy. So it will kill the active form, kind of the corkscrew that drills into tissue. It's not a blood organism. Now, when it wants to defend itself from, let's say, doxy and amoxy, it becomes a nut form. So imagine a walnut or a pecan or whatever your favorite nut is. There's only a couple things that will get through that hard protective cyst or nut form. It can also become what's called a persister. I think that's really not a helpful word unless you're pretty adept at these things. But I call it the frozen form because treatments come, antibiotics are around, it's not moving like it's in the freezer. And there are some meds that will kill it, but not doxy and amoxy. And then last, but definitely not least, is we know since a publication in Nature 2000, and then I followed up with a book, Biofilms, in 2014, which I think may be still the #1 book on the topic, certainly affordable, is that if you think of Lyme as an egg covered by jello, 6 inches all around, well, almost no antibiotics are going to get through that, and certainly not doxy and amoxy. So killing that is, we wrote a book on it and for another talk. So doxy and amoxy does kill the active form, does not kill the nut, does not kill the frozen form, and is useless against biofilms. So if they're treating you for Lyme from 30 years ago or 3 weeks ago, it's a concern that they're going to get 100%. Have a great day. Thank you for your time.